So my patient here today has cancer and he's here for a chemotherapy drug infusion. So we're going to be using his open tunneled line, central line, to infuse some of the chemo drugs into him. So I'm going to do hand hygiene before I go in and give him some privacy. And then I walk in. Hello, I am Sim. I'll be your nurse today. And can I have your name and date of birth before we begin? Thank you. And I check the MRI number and that it matches, and that there's an order for this for these drugs that I'm going to give and what line it's supposed to be through. Okay, so I'm gonna do a dressing change on your central line, tunneled line, and I'm also going to take some samples in and send it to the lab later. Okay, so we can begin by taking off the old one and assessing the site for any phlebitis or anything that shouldn't be, that is not normal with the line. So we're gonna do this here, and I'm gonna put on some to take the old one out. Okay, I'm gonna pull out in this, and sort of stretching it out to the outside and making sure I don't pull the line out. Like that. Okay, and I'm gonna get rid of this. And okay, and then I'm gonna take my tape measure and I'm going to measure the length, make sure that it matches that of the previous insertion length, to make sure that none of it got pulled out since then. And I'm gonna kind of touch around here and assess for pain, swelling, any drainage. And once I'm through with that, oh, and I can take this one off. Okay. Once I'm through with that, I'm gonna take these off. Wash my hands again. Okay. I'm gonna open my sterile kit. Just like that. And then I'm going to be putting on my mask and put one on the patient as well, so that there's no infection or there's no cross-contamination on the site. And then I'm going to be taking off putting my sterile gloves on. Okay, and now I'm able to, all right, get some of this alcohol, or actually this is chlorhexidine, and I'm gonna swab like this, site pretty well, and the line too. Okay, now I'm through with that. Let it dry so it dies. I'm gonna want to put, okay, let's imagine that this is already in here. These are all in here. So I'm gonna put this on. And I'm going to put on my new, and I'm going to put on this. And then finally, I'm going to put on the dressing. And I'm going to, I'm done with my sterile field now, so I can take these and get rid of these. And then the next thing I'm going to do is collect samples. I can take this off. Do hand hygiene one more time. Okay, so okay, I'm gonna grab my flush and I'm going to flush it, unclamp. Okay, after flushing the line and make sure it's patent, I'm going to draw some blood. All right, I can see that the blood is coming back in. So once I did that, I can take this off and throw away my flush with the blood in it. I'm gonna grab a brand new sterile 10 milliliter syringe, and I'm going to now put it in and take out my sample. We'll unclamp it again. Take to the indicated mark that they want, the lab or the hospital wants us to take. And then I'm gonna, oh, also I want to add that when I flushed it, I did it in a pulsatile motion to prevent any obstruction. And now I'm gonna switch out to the, leave it on the sterile field, switch out to heparin, clamp, sorry, clamp, and then put on my heparin, unclamp, and also I got all the air out beforehand, and again in a kind of pulsatile motion, I'm gonna do this, and as I'm pushing this, clamp it out, and I'm done with my line. Put on a new sterile green cap. Now let's do our samples. For oh, again, I want to add also that with the alcohol wipe that I scrubbed the tip before I put in my flush. Okay, so I'm gonna first do my blue. I'm gonna do so like that. Okay, I think because there's too many holes in it, it just won't come in, but that's the blue one. And I'm gonna invert this about 3 to 4 times. And then I'm gonna do my red one. Also get a little bit and do about 3 times. And then I'm gonna make sure I label these with the MRI number and all the little information that I print out, and I'm going to put it in here. Also put label in here, and I'm going to send these collected samples down to the lab. Clean up everything, make sure my patient has coli. Do you feel everything okay? Can I do anything else for you? Okay, and that does it. Thank you.